think you meet people from all walks of life and they all have different needs, and you've got to try and address those needs. As I said earlier, we do come from an area of great deprivation, but everybody deserves a fair chance in life.
Well, I think with diabetes, everybody, when you've got diabetes, it doesn't go away. It's a lifelong condition, and the only person who's there 365 days a year to manage that is you.
Well, I'm a doctor and a professor, and I specialise in diabetes. But when I got diabetes, I learned that there was a lot about living with the condition that I was ignorant about.
There you are, chugging along nicely, bit beefy like, but not fat as such, enjoying the odd pie and the not so odd pint, feet up on the sofa and finger on the remote, slipping happily towards retirement, when bam, out of the blue, a letter, clinic, well man checkup, blood pressure up, blood tests, nothing to worry about, Di. Or routine see, Di. Diagnosis, diabetic. Oh, damn.
Enter. Mr. Jones. Well, we've had your blood test results back, and I'm afraid to say that your blood glucose levels are rather high. So I'm afraid to have to tell you that you're a diabetic.
What? Diabetic?
Unfortunately, yes. You'll need to see the nurse. She can tell you more about it. And then we'll make an appointment with the dietitian, and I'll see you in 6 months. Sorry about that.
Well, in the valleys where you see, which is an area of high deprivation, you will see people with some of the highest numbers of people really in Wales in these areas. Again, this is due to deprivation, and you normally see pockets of people here with chronic conditions. I mean, diabetes, the numbers here are sort of some of the highest that we've got in Wales. So we identified very clearly that there was a need for people with diabetes to have access to information, and self-management programme which we run as well. I'm Wendy Gain MB. I'm the coordinator for diabetes peer support in Wales. We're based in Penrhyn Cyber Institute. We've had an office here now since Christmas. With diabetes peer support, it was set up nearly 3 years ago, basically for people with diabetes, their families and carers, and that ranges from children and young people to people who are of the older age range as well.
I'm Carol Phillips, and I'm from Cwmdale and Aberdare. Well, first of all, I had 2 bereavements in 10 weeks, and it seemed to have come out on me then. I couldn't understand what was wrong with me, and the doctor thought it was stress. 2 visits, he said, "Oh, you're stressed out, what do you expect? You've had 2 bereavements in 10 weeks. You know, so I went on the 3rd time, and there was a locum there, and he said, "Well, everything you've told me now," he says, "pointing to diabetes." And I had the blood test, and I was diagnosed, and it was. And that was 12 years ago. Yeah, well, it was very traumatic, because, you know, you go through your life, you don't expect something like that to happen to you. It's a big learning curve, a big change. And I was all alone then, because I'd lost my husband, and I'd lost my mother, and I was on my own, and, you know, I just couldn't get my head around it very good. I had a lot of information off Wendy, and a lot of help along the way, and I've come through it. Oh, big difference, because you get a lot of information and help. Yeah.
The kidneys, but I can't answer medical questions other than that information that I can give you.
But my kidneys are fine.
And so take that to the nurse. Okay, I'm Professor Jonathan Richards. I'm a GP in Merthyr Tydfil, and I am living with type 2 diabetes. And so I know quite a bit about the condition, both as a doctor and as a patient. The body needs energy to work, and the fuel that the body uses is glucose.
Yeah! One more.
A chemical called insulin is produced by the pancreas gland in the tummy, and that tells the body what to do with glucose. So, for example, it will store glucose in the liver, it will tell muscles to take up glucose from the blood. And in a healthy person, insulin is produced after a meal so that when we've eaten our food, the glucose goes to where it's needed. There are two types of diabetes. There's type 1 diabetes, where the body fails to produce the insulin chemical. So without the insulin chemical, people become very ill, and they're usually becoming ill very quickly, and they need to have insulin in the form of an injection to help their body know what to do with the glucose that they eat in their food. That usually affects children and young people.
Well, type 1 diabetes is a condition where most of the pancreas does not produce insulin. You've almost got a complete lack of insulin production in people with type 1 diabetes. So clearly the blood glucose will increase. There's no way of getting it down. And in fact, you have, therefore, in those individuals, provide them with insulin that they can't provide for themselves.
My name is Kerry Jones. I'm a primary care diabetes facilitator for Cwmtaf LHB. Diabetes frightened me to death. Didn't understand it at all. Then my son was diagnosed with type 1 diabetes. He was 6.5 when he was diagnosed, which was quite a shock to all of us because nobody in the family had diabetes, type 1 or type 2. It was quite traumatic because initially I felt that it was something that I had done, that it was my fault. Even though logic and the reasons why type 1 diabetes happens would tell you different, it still feels that sometimes it's why me and why has he got to have diabetes. So I felt it was something that I had done.
I'm Lucy Collins. I'm the paediatric diabetes specialist nurse for the North End of Cwmtaf NHS Trust. I work with children from 0 to 18 who have diabetes, supporting and educating the children, young people and their families. The majority of children are diagnosed with type 1 diabetes, but we are seeing an increase in type 2 diabetes in children as well. And each age group have their own sort of challenges, from the very young children being fuss eaters, the nightmare of parents trying to feed them when they don't want food, to primary age children starting to look for their independence, moving them to comprehensive school, and then the challenges of adolescence itself, where they're striving to become independent, where they may have families who don't want them to be quite as independent as they would be without diabetes. Over the last 5 to 10 years, there's been massive progress made in research into type 1 diabetes, and hopefully in the near future, in the years to come, that there will hopefully be a cure for children and young people with type 1 diabetes. Type 2 diabetes is all about re-educating children and families about lifestyle issues to hopefully minimise the number of children and young people being diagnosed with type 2.
I'm Emily Hancock. I'm 19 years old and I'm a type 2 diabetic. I'm in Glamorgan University doing nursing. I was diagnosed in year 7 of Avontaff High School. I was 11 years old. I was 8 years ago. I was called out to school one day and I was rushed into hospital for a week, close to being into a coma because my sugar level was 25. I'm on tablets 3 times a day, 850 milligrams of metformin. I got to take them straight after a meal every day, so the tablet kicks in and reduces my sugar straight away. It hasn't really affected me that much. I sort of got used to having diabetes straight away because I was at such a young age. At the moment, it hasn't affected me at all. All my lecturers know that I've got diabetes. I'm the only one in my class who's got it. But if I've got any problems, I can go and see the nurse anyway, or they just let me out of the room to have 5 minutes, or I can eat in class anyway, so they're fine, they haven't got a problem with it at all. I've just completed my first year now, so I got 3 more years, and then hopefully be working in Prince Charles in September.
I'm Carol Andrews and I'm the school nurse at Avontaff High School. When I started at Avontaff High School, I knew very little about childhood diabetes. All that quickly changed when I discovered that Avontaff had the highest number of pupils with diabetes in the Merthyr area. We had 9 pupils in total. We had already tried buddying up a newly diagnosed pupil with an older pupil and felt that the diabetic pupils would benefit from a peer support group. We need a specific group for young people with diabetes in secondary schools because when they're first diagnosed, they have problems adjusting to their new condition, and we found that it's nice for them to have the support from other children or young people in the same position as they are.
Type 2 diabetes is a little bit broader in insulin. You may well also have a defect in the insulin-producing cells, but predominantly these people will also be insulin resistant. And it usually happens later on in life, although recently with the increase in the amount of people with obesity, for example, and children are now becoming more obese at a younger age, and in fact they also become insulin resistant. The more overweight one is, the less effective the insulin is.
So, 6 weeks later, I get an appointment with a practice nurse. Better get used to me, Di. You're going to be seeing a lot of me, you are, in the future.
Better get used to
like
me,
a stick
Di.
she is.
You're going to be
She
seeing
wound me
a lot
up.
more of me here in the future.
We'll make an appointment for the dietitian. Give me a meter and lecture about weight and exercise. Showed me how to do me blood. Don't worry, Di, she said. It won't come to insulin. I started to get a bit worried then. We'll make an appointment for the dietitian.
My name's Helen Zenon. I'm the diabetes specialist dietitian based at Prince Charles Hospital, and I cover primarily the Merthyr and the Cynon Valley patients from those areas. As a dietitian, I'm obviously biased, but I feel diet is the most important aspect of managing diabetes, simply because everybody needs to eat. Most of the glucose in our blood actually comes from the foods that we eat. There are various medical treatments available, so you could be taking tablets and insulin, but all of those people with diabetes that have diet in common is the most fundamental part of your control.
With type 2 diabetes, it's much more about your lifestyle and whether you're taking enough exercise, because if you exercise, that will lower your blood sugar levels, and it will also help your muscles and your liver respond better to insulin. So if the body isn't responding to insulin, that means that there is then too much sugar in the blood because it's not going into the muscles for energy and it's not going into the liver for storage. When that happens, the sugar in the blood affects how the body works. And over many years, people then become more likely to have heart attacks or strokes, more likely to have damage to the back of the eye, to the kidney, and to the circulation and nerve supply to the feet.
The general population generally ignore their feet, but unfortunately with diabetes it's something you can't afford to do. My name's Scott Corley, I'm Professional Lead for Diabetic Foot Services at Cardiff Vale University Health Board. One of the main reasons with diabetes is you will get complications to the circulation and the nerve sensation to the lower limb. And that will make you very susceptible to traumatising your feet and not knowing about it. The evidence has shown that up to 15% of all patients with diabetes in their lifetime will develop a foot ulceration. So obviously identification of that is very important so you can get the right response at the right time to try to heal up that ulceration. The big problem we have is there's a lot of complications with arterial disease with diabetes, therefore they're more prone to heart attacks and stroke, but of course the lower limb disease does make them more susceptible to unfortunately having amputations.
I'm Julia Platts. I'm one of the consultant diabetologists in Cardiff. I work with the diabetes teams in Llandoch Hospital and University Hospital of Wales. And I've also had a role in the past in working on the All Wales guidelines, particularly with regards to pregnancy and diabetes. Pregnancy is a particular issue for women with diabetes because a pregnancy in a woman with diabetes can cause problems for both the mother and the baby. The good news is that if they have good care, if they have a certain amount of input, then we're able to get rid of a lot of these problems in pregnancy. The sort of problems that a woman can get, a baby can get, are something called congenital abnormalities, such as heart defects in the baby. There are other problems such as babies becoming too large during pregnancy, and that causes problems during the pregnancy and during the delivery. Or the baby could have low sugars following delivery and have to go to a special care baby unit and be separated from its mum. But as I said, if there is good care, if the mother and the diabetes team are able to work very closely together to achieve some targets, then for the vast majority of women there's going to be a happy outcome of these pregnancies.
Patients with diabetes have an increased risk of developing heart disease. They have a 5-fold risk of developing cardiovascular disease, which is any disease which affects the heart and circulatory system. And 2 out of 3 diabetics will develop heart disease at some point in their lifetime. My name is Alison Allen and I'm one of the cardiac nurse specialists at Prince Charles Hospital, and I work within the cardiac rehabilitation team. Patients with diabetes are prone to atherosclerosis, which is a medical term for furring or narrowing of the arteries. And this process can affect the arteries supplying the heart muscle, which can cause conditions like angina and a heart attack. But it can also affect the arteries affecting other parts of the body. For instance, those leading to the brain may put them at risk of stroke.
I suffer with my heart now. I've got heart disease because I've had diabetes for so long. My parents were worried, took me to a few local doctors who said that there was nothing at all wrong with me. I'd paid privately to see a paediatrician at Aberdeen, who just took one look at me and said, "You're a diabetic." And then I was in hospital straight away. As a child, I grew up with it. I don't think it's been a difference in the way that people always expect a difference from that to the difference now. It's finding out how exactly things change within the regime of testing and being more aware of more young people coming with it, knowing all the latest information and technology that's available to aid you with your diabetes. So it's fine to find out this information from a set place from the support group.
Healthcare professional, what your goals should be for controlling your diabetes.
So the purpose of treating diabetes is to reduce the risk of any bad things happening to somebody and to help people feel better and live a normal life.
I used to get angry about it. I look at all these people who were fatter than me and they didn't have a problem. They didn't have to watch every step, count every currant in a bun. We're all heading in the same direction, but it seems I'm heading there quicker than the bloke next to me.
crikey. I think taking control of their own life and their own condition, finding out information and trying to put that information into their daily lives. We also do events, and we've just had a recent conference, and I mean the agenda for that conference, it was really successful. That was decided by people living with the condition, and I think you were more empowered once you have the information to take a look at what you've been doing and how you've been looking after your own diabetes. Because what I find, and having diabetes myself, is that there's always something new to learn about it.
Maybe it's the psychology of it. How your body turns against you, becomes disordered, a condition. It becomes about control, and food becomes a medicine. Every aspect of life becomes medicalised. No wonder people get upset.
Well, everybody has their own response. Some people will have diabetes in the family, and you may get one person whose mother has never had a day's trouble in her life and she copes perfectly well, so it isn't a problem. The next person, their father may have died of a complication from diabetes, and for them, the diagnosis is a bombshell that is very distressing.
So far, I haven't had much bother. I've just had my review and had all my checks, plus kidney and liver tests. Kidneys are alright, but the liver was a bit iffy, they said. Lucky I don't smoke. I try to keep on the straight and narrow, I do, but it's hard.
People have told us that this is the first opportunity they've had of speaking with someone else who's actually got the condition. And they find that sharing their experiences of living with diabetes with each other often helps someone, for example, who could be newly diagnosed. Or those who've had established diabetes, they could be going through a difficult period where maybe they've gone from tablets onto insulin, and there's always someone there who can relate to you with that condition.
Well, it's really about managing their condition in a proactive way, and this can be done in conjunction with their GP and their practice nurse. I think 24/7 the patient with diabetes or the person with diabetes has to manage their condition. You know, you may only see your GP once every 6 months, once every year, so you're very much in charge of your own condition the majority of the time, and support from other people with similar problems has shown to benefit patients, not just with diabetes but also with heart disease and other long-term conditions.
Self-care is very important. Prevention is the name of the game. It's sometimes called the PITS, prevention, identification, treatment and systems, and prevention and identification will always be the number one. So if you examine your feet and identify there's a problem on your feet, you can do something about it.
People hate being told what to do, hate it, and as a dietitian I'm living with a legacy. They all think dietitians tell them what to do, but I try to look at what a person is doing, suggest ways that they could improve, and let them usually pick which one they would like to do, and that's part of self-management because they're deciding for themselves. But it's crucial basically because you can only really do it if you've decided it yourself.
It's very common for people to feel a bit depressed and low in their spirits because they've suddenly lost the health they thought they had, they've lost the healthy future they thought they were going to have, and it takes time to come to terms with it. But again, peer support can be very helpful because you talk to other people, you can see their confidence. You know, some of my friends with diabetes have had diabetes for 50 years. And when I found I had diabetes, that was my goal, that I wanted to live life to the full for the next 50 years. And that's still my goal. And it helps to motivate me to look after myself properly.
My name is Laura, and I was a carer for my mother who had diabetes. My role as a carer had gradually started about 2 years prior to her diagnosis. She had other serious health issues. working full time and being a carer was very difficult, and it was just something that I just had to get into. I didn't have the luxury of sitting down and thinking about it. I just had to do it and get on with it. But it did affect me because I couldn't sleep. I was having terrible problems with sleeping. There was a big difference with insulin medication as opposed to just taking a pill. Obviously, I had to learn how to give her the injections. You had to pick the site to give the injections, and then you had to watch for a hypo state. That was a bit of a challenge. And I don't think we had enough of information about what to look for. We were invited to attend a training day at our GP practice for both diabetics and their carers. And I went along. My mother was unable to go, so I went along, and I found it very, very helpful. I feel I want to do as much as I can to help anyone that's got diabetes, and from the caring point of view, because it can be quite difficult. So if I can help in any way, this is what I'd like to do. So that is why I've accepted to join on the course for diabetes carers.
And if some say you get what you deserve, but they're wrong. Sometimes you get what you're given, and then it's all gone. And you are lucky if you are sufficiently strong to daily decide not to die. Oh, the nights are long, but life is longer still. Oh, the nights are long, but the sun's coming over the hill. I can't say there's many things I wouldn't change. There are better days gone than those that remain. But I can find joy in the sound of the rain. You have to find joy where you can. Oh, the nights are long, but life is longer still. Oh, the nights are long, but the sun's coming over the hill. Oh, the nights are long, but life is longer still. Oh, the nights are long, but the sun's coming over the hill. The sun's coming over the hill.